everybody. Welcome back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed, and I'm a fourth-year medical student at the University of Toledo. And this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk with medical students who are interested in ophthalmology, with residents who are training in ophthalmology, and with current ophthalmologists in the field today. And today is a special 50th episode. We made it this far somehow. People wanted to talk on the show, so I was lucky enough to get some guests, and now we're here. So I want to kind of share with you. This is going to be a kind of a different episode. I'm going to be here. We're talking with one of my first mentors, Dr. Sridhar, and also I'll be joined by a co-guest host who is a good friend of mine, Ankur Parikh. So Ankur, go ahead and say hi to everybody who's watching this episode.
Hey everyone, I'm Ankur, excited to be here and think this should be a good conversation.
Yeah. So Ankur and I became friends kind of on this virtual year. We got connected through Dr. Tim Steinman at the Cole Eye Institute, who introduced us. And from there, we realized that we had a similar mentor who was Dr. Sridhar, and he was kind enough to be kind of mentoring us both through this virtual interview year, getting involved with some research. And since then, Dr. Sridhar has been a source of knowledge and been somebody who's really guided us through this year when both of us were just third to fourth year medical students looking to find our way through this path and learn more about ophthalmology. So with that, I want to welcome Dr. Jay Sridhar. He's the Associate Professor of Clinical Ophthalmology at the Bascom Palmer Eye Institute, where he's also the Associate Residency Program Director. So Dr. Sridhar, welcome.
Bilal and Ankur, thanks for having me. Bilal, 50 episodes in such a short time is super impressive. You guys should be proud. That's in just a few months. Most people, it takes years to get that many episodes, so congrats.
Yeah, thank you. And for anybody who's not sure, Dr. Sridhar is actually the king of podcasting right now. He's the host of the Straight from the Cutter's Mouth, the Retina Podcast, and he was also the first person to kind of tell me that I should release this show in audio format. So Dr. Sridhar, I have to thank you for that, first of all. And since then, we made the show a podcast as well. It was initially a YouTube show. But with that, I guess, Dr. Sridhar, we have a lot of things we want to talk to you about. It's kind of a different episode. And I usually ask people their origin story. And I know you've belabored the point on a couple of your own podcasts, and you kind of given your origin story in episode 100. Straight from the Cutter's Mouth. But is there anything that you just want to share really quickly about your path that maybe a medical student out there might take away if they're interested in ophthalmology and they just don't really know how to do it?
That's a great question. I think that the biggest thing is that it's never too late. I think the most common question I get is, it's third year or it's late in third year. I don't know if it's too late. I know people have known they want to be ophthalmologists since they were like 5, or at the very least since college or entering medical school. I'm too late to the party. And I think as long as you've worked hard in medical school and you find mentors and you put the work in, it's never too late. I mean, I think we even have people who enter other specialties and finish residencies and then decide to become ophthalmologists. So I think if it is something you're potentially interested in, explore it, and don't ever kind of limit yourself by saying, hey, it's too late for me, I'm just going to do something else. Don't get intimidated by people who have put in time before you have. It's not about, obviously time in is valuable, but really it's about the quality of your application, not necessarily the quantity of years that you spent thinking you wanted to be an ophthalmologist. Got it.
And, going from there, we're kind of going towards the tail end of a different topic in that same regards though. But, we're recording this on December 2nd, and Ankur and I are both going through the residency application and interview process now. And in a couple of weeks, and when this episode probably will come out, it'll be near the time that rank lists come out. So is there any advice you have for any of the fourth year medical students who are, in the process of finishing up interviews and starting to think about their rank list? What is the kind of factors one should consider when they think about a rank list?
Sure. First thing I would say is I think it may be different this year because with virtual format, maybe you have multiple interviews on the same day. So maybe have multiple days like that, 4, 5, 6 days in a row. I don't know how you guys have structured it, and you guys can comment. But what I would try to do historically, what I recommend is make a running rank list. It can be modified at the end, but as you do your interviews, kind of been like, okay, A or B, A, B or C, well, where does that fit in? And if you do that, it will be a lot less overwhelming. The second thing I would say is take notes kind of between your interviews or during the day or right after. Write it down when it's fresh, because what happens is it all kind of blends together, and there's a recency bias and that happens on both sides. It happens for people interviewing and it happens for the interviewees, where you may remember your last couple of programs at the middle end of December really well, but then you're like, man, but what happened about that program in October? People are providing more standardized information, right? Programs are sending you brochures and packets that have a lot of the information you would want to know that we'll talk about in a second. But try to kind of jot down things when they're fresh and try to jot down those gut feelings. It doesn't mean that they're going to determine your rank list, but it's important to say, okay, how did I feel today? And why did I feel that way? And kind of introspect a little bit. In terms of making a rank list, there was a great article written probably 4 or 5 years before I applied by Ruben Sanchez, who at the time, he was like the chief resident at USC out in LA. And he wrote an article, I don't remember for what trade journal it was. It might have even been in Ophthalmology. And it was about the 10 most important factors for making a rank list. And he kind of went in order. And I thought it was really, really candid. And that list is available still online. But I remember going through it. And I think the most valuable thing I took from it, and probably most important to most of us, is geography is going to play a bigger role than you think. And I think that's important to realize. I think we all are willing to go anywhere to train. But when things come down to it and you're between two programs that might be very similar and very attractive, you're going to make geographic choices at some point. And so hopefully you've made those choices. You have a 20 interview cap, and hopefully you made some of those choices along the way if you were close to that limit and had to choose between programs, or if you had to prioritize one interview over the other. It's not a bad thing to say that. I know we always want commitment from people, but it's okay to say, you know what, when I'm making my rank list, I may rank program A over program B because it's closer to my significant other, it's closer to my parents, it's closer to where I want to live. The second thing you should look at is what do you think you're going to do with your career? It's okay, again, not to know exactly what you're going to do, whether you're going to do a fellowship or whether you're going to do comprehensive ophthalmology. But what are kind of the potential options you want? And which programs will prepare you best for that? Now, hopefully all the programs will prepare you really well to be a comprehensive ophthalmologist, but some programs are better than others in terms of getting you a fellowship spot, for example, or getting you the fellowship spot you may desire. So kind of look at the track record of where did people from this program go? Why are they choosing to do these things? Beware of small sample sizes. If you're talking about a residency of 2 or 3 people, you can't make big decisions being like, well, all 3 residents went to comprehensive. That means they must not have been competitive for fellowship. And people make individual decisions. But if you can kind of get a sense from either program's website or from the information they give you of, hey, over a 5 or 6 year period, what are people tending to do? Where are they matching? That's really helpful because you want to not close doors if you can. And that will help you, again, kind of prioritize different programs. And there's other factors, but I really go back to that gut feeling thing. It's a little harder probably with virtual. And again, I'd love to hear your guys' experience, whether you still get this in a virtual format. But you can't fight the gut feeling part in terms of the interactions you have with the residents and the leadership and the culture of a program. Don't read too much into it and use your mentors, again, to kind of proof your list and be like, okay, is this actually something that makes sense to put this program above the other? They might be like, well, these programs may be tiered differently, so maybe you don't want to do this, or why are you really thinking this? But if you have programs that are similar caliber, it's okay to go with your gut at some point. If you felt like you were a better fit somewhere, if you felt like they were more welcoming, if you felt that the culture was more of your fit, it's okay to prioritize that over another, assuming that they're fairly close in terms of level. And again, I'll go back to point number 2. It really all depends on your goals. If you kind of know right now, hey, I just want to be a really good, solid, comprehensive ophthalmologist, that's not a just, that's fine. That's absolutely great. We need people who are going to be really good doctors. And you can get that in a number of programs. You might as well pick the program where you're going to be happiest. But you want to keep your doors open in case there are other opportunities. And that's where it comes down to. You really want to take programs that can match you well for fellowship and at the same time offer a diverse surgical and clinical education.
Great. Yeah. And I think that's one thing that Ankur could probably comment on too, is that as medical students, we're so kind of tied down to thinking ranking and or not even prestige, but you think about reputation, you think about names and stuff like that. And I think maybe Ankur can comment on this too. But now on the other side of things, when you're finally past that point of being a medical student who's applying to being on the side where you're interviewing now, you kind of see the people more so than the name. And that's kind of important. So Ankur, do you want to talk about your experience this year and how it's been for you on the virtual interview trail? Have you had any of those feelings of, seeing somewhere, a place that's kind of fit your goals and like Dr. Sridhar talked about?
Yeah, sure. So it's been really interesting because, as Dr. Sridhar mentioned, it feels like it's a little harder this year. Obviously, we didn't go through this in an in-person format, but it feels like it's sometimes hard to really get a feel for what a place is like. Everyone says that the first time they stepped onto this campus or they stepped into the interview room, they just had this gut feeling that this was a place that they'd be happy. And so that's definitely been really tough. But I think what's been really cool and what a lot of programs have done a really good job with so far is really giving us time to talk to residents, see residents interact with each other, see residents interact with faculty. And I think seeing those kind of interactions, along with also, talking to mentors about what they've heard about the program and talking to residents kind of offline or on the phone has been really good. And I think a really great way to try to get some of those subjective feelings about a program without actually, setting foot there.
Absolutely. I think that's one thing I didn't realize is that you do get a lot more of a sense of a place. I think, obviously we're not done with this process yet. Then I realized virtually you do really get a sense for the faculty and the resident meet and greets and stuff like that. So It's a different taste on things, but I think it's a good way to get some feel in a year like this. So Dr. Sridhar, we want to ask you, I know you're a very pragmatic person. I think that's one thing I've learned about you from our interactions is that, I kind of tend to think ahead a little too much and you're like, all right, slow down. Let's think about where we are right now and then we'll move forward from there. So you're very pragmatic in that regard. But, we want to really ask you about how we can, after post-February 1st, people are going to be wondering about residency itself. And we have some questions just about how to be a good resident, really. And Ankur, you had a question about research. So do you want to ask Dr. Sridhar about that question?
Yeah, sure. So, the gist of the question is that a lot of med students these days are involved in research, especially ones going into ophthalmology before they start residency. And so the kind of question Bilal and I had is, how do you recommend trying to keep up with the research that we'd started in med school and then just continuing on? Because there's so much going on as a resident, between learning to be a good clinician and surgery and all your other responsibilities.
That's a great question. And I think the first thing is, and everyone has different rules, I think it's really important not to have unfinished business. So if you have projects that you're kind of like, hey, I have this outstanding, I think I can wrap this up, I personally just try to wrap those things up. Now, if you may want to continue doing projects into the spring past graduation, but some people don't want to. Then it's okay to say, I want to take this time to focus on other things. I've spent the last 6 to 12 months really focusing on research in my ophthalmology application. Mm-hmm. It's okay to take a break. I mean, many of us do, and I'll be very honest, when I was in that position, it's not like I was doing hardcore research. I kind of wrapped up what I needed to do by January, and then those next few months were a nice time to reflect and spend time with my classmates and kind of finish up medical school. If you do want to take on projects during that time, I think it's completely reasonable. Understand that your internship obligations may vary, right? And so if you're in a traditional medicine or surgery type internship, or even some of these integrated programs will have a pretty busy intern year, sometimes it's hard to follow through on some research. So again, you really don't want to bite off more than you can chew. You want to be realistic about the time you have. Try not to have anything rolling into your intern year, because where research mentors can get frustrated is when you have something that's outstanding and it goes and lags and lags and lags. And that may not be the fault of the medical student or now the intern or resident when they're training, but it's just the nature of the beast. So again, I would personally say wrap up what you have that you think you can wrap up. If you want to take on more, you can, but try to take on things you think you can wrap up, or you kind of know in advance what your intern year schedule is more or less going to be, then you can factor it in. In terms of residency, I think the number one goal, and every program is a little different in terms of how much research they want you to do or they encourage you or allow in their scheduling. But I think the most important thing is being a good resident and learning how to be a good ophthalmologist, right? So don't put your research ahead of seeing patients and taking care of patients and reading about your patients, because you have the rest of your career to do research projects. You only have 3 years and now sort of 3.5, 4 years for integrated programs to really build the base of your career. And people say this all the time, but realistically, you're going to be pretty formed when you leave residency. You're going to add on top of that base, but the chances that you're going to fill in all your holes and gaps as a fellow or as an early young attending are low. You're just going to be really busy and learning more complex stuff if you're doing fellowship, or if you're a young attending, you'll be encountering all the real world challenges of being an attending. So that's my only caveat. I'm very supportive of residents doing research, but always try to remember, don't bite off more than you can chew, and never pick research over your clinical obligations, because they're not just obligations to your program or your co-residents. Those are obviously important responsibilities you have to others, but it's also an obligation to yourself to try to be the best ophthalmologist you can be. And you only get one chance to do that. So again, there are some programs that'll have built-in research time. It's pretty uncommon though, to have built-in research time first year. And again, that's because the learning curve is so steep.
Got it. So, going from there, Dr. Sridhar, we have a long sort of history with research with you at this point, but going forward from there, we are looking forward to being residents, and we get excited about the prospect every day the more we interview our program. So, what are some keys to being a good junior resident? What are some keys to kind of tackling that learning curve when you get to that PGY 2 year, especially after that intern year where it may be a little different, and really getting to be a good junior resident? What can you do to be helpful? What can you do to really take ownership of your learning? Do you have any advice on that?
Sure. I wrote an article, actually like a blog post about this years ago, and I think the rules are still the same. This is just one person's opinion. I mean, everyone can have different opinions about what makes a good resident, but in very short, come early, stay late, always take the next patient, be the sort of resident that you would want your co-resident to be like. Be willing to learn, leave your ego at the door. And that's not just with your senior residents or faculty, that's with staff, ancillary staff, everyone from the quote unquote lowest person in the totem pole in the building to all the way up to the head of the department. And read. Reading is the hardest thing. I will say no one ever regrets reading too much. We all regret not reading enough. And I think I tried to read as much as I could. And I try not to beat myself up about it because I think you do the best you can. But I always wish I had read more. There's never a time I'm like, man, I really wish I hadn't spent that weekend reading about something. Try to carve out time to formally read. Now, there's different ways to approach that. Some people say every patient you see that's interesting, jot it down, read about it that night. That's ambitious depending on how busy your program is, right? One of my co-residents did the math early in first year and said, if I read 10 pages of the basic science series, which is this huge set of books you get at the beginning of residency, I could finish the whole set once a year and read it 3 times. Well, realistically, depending on how busy your program is, your motivation, that's not going to happen for most of us. We all study in different ways, and you should know the best way you study. For me, I would quote unquote binge read. I would take if I had a full weekend off, I would take one of those 2 days and sit for 3 or 4 hours and just read. I would pick one of the basic science books and just read it. And it was super painful sometimes. And again, you don't always know about the things you're reading about, but that's how you build your base. And you need to do that. Even if you're at a busy program, you need to read, because it's not enough to say, hey, I'm in a busy program, I'm seeing lots of patients, that's going to be enough. No, you got to read, because you got to fill in the gaps. There are going to be things you don't see, there's going to be things you don't hear about, and that's going to make you ask questions, and asking questions is what's going to make you become a better ophthalmologist. Now, at the same time, if you're on call and you know it's going to be busy, it's okay to bring a book with you, but you shouldn't be reading a book instead of seeing patients, because there is no real replacement for doing the exam yourself and going through the diagnostic process yourself. And learning to be efficient is super important for the health of your career and the health of your patients too, because more and more is demanded of us clinically on a day-to-day basis. So I would just say those things. And the last couple of points about being a good resident are kind of tie into those, but try to be respectful of your patients. They are giving you the privilege, for example, of operating on them as a trainee, seeing them as a trainee, doing procedures on them as a trainee. Part of that respect is preparing, right? Reading, watching videos, not coming in late, showing up early, and being prepared to operate on them. It's a privilege to do that. And be respectful of everyone around you. I know I kind of said this, but the best residents treat everyone in the team as part of the same level. They don't treat ancillary staff of any level, quote unquote, below or above them. They everyone's on the team, and then we're all working to take care of patients. Those are the big things. I mean, you guys can comment. You guys haven't worked in residence, you worked on wards, but you guys probably have ideas, right? Medical students you like doing rotations with, where maybe there's some people you rotated with, you're like, I could take it or leave it. Maybe I'd be better rotating with this other person. And again, you guys had a little different experience because half of your third year was interrupted, but you probably got enough of a taste to get a sense of there are certain residents or medical students who are preferable to work with. Well, you want to try to be like those people. What are the things that make those people tick?
Sure. No, absolutely. I think me and Ankur have bonded over this quite a few times in different conversations about, our experiences in medical school. And, part of being a junior is eventually becoming a senior and having that leadership role. So Ankur, you had a question about being a senior resident. Go ahead and ask that.
Yeah, sure. So, I mean, you had a lot of good advice about, being a junior and reading. And so as you become a senior, I think one of the things Bilal and I were talking about that feels like it'll be hard to manage is how do you continue to solidify your skills clinically, surgically, but still, work and be a mentor for those junior residents that are coming in and make sure that you're there for them when they need it as well.
Again, everyone's different, but I think you learn the most when you're teaching other people. That's when you really can learn. If you, again, leave your ego at the door and you're humble, that's when you learn where you still have gaps in your knowledge. When a junior resident asks you a question that you're not really sure about the answer to, or if they say something and they disagree with you politely and you're like, well, maybe I should go check that. Maybe I am wrong. Maybe I had wrong ideas about some things. The worst thing you can do as a senior resident or a teacher, any sort of authority figure, like I could say even the coach of a football team or basketball team or the president even, you have to be open to feedback. If you ever just say, well, because I'm in this position, I must be correct, then you're going to stagnate. You're never going to get better and you're not going to get the best outcome for your patients. You're not going to be a good teacher. Now, you still have to establish some sort of authority, and that's going to happen naturally. You should know more as a third year resident than most of your first years. Every once in a while, you have an outlier first year who just knows everything. They're like an encyclopedia, but you still have a practical hands-on knowledge that will help you give something to that other person. at the same time, you are not always going to be correct about everything. So I would just say the biggest thing is just be open to listening to people. Alan Ho was one of my mentors. I remember we used to have a Retina research conference on Mondays when fellowship. He would invite medical students to that conference. And part of it, maybe some of them showed up because they're like, oh, I should probably go because this is part of what they're requiring me to do. And I want to get a letter. But I think some of them were really interested, and he would let them speak. And he used to say, having students and young people around is the best way to develop research ideas because they ask the questions that no one else will ask. And 80% of the time, those questions don't go anywhere. They're a question that's already been answered, or it's off base completely. But the other 20% of the time, they're going to ask something and you're going to scratch your head a little bit. And if you actually sit and listen to what they're saying, or a junior resident in this case, you're going to be like, you know, that's actually an interesting question. You're going to read about it. And sometimes you'll find the answer hasn't been done. Maybe that's how you form a research project or a research question. And sometimes you'll find the answer and then you actually can improve your knowledge. And again, as a third-year resident, that's really when you're solidifying your surgical skills, not just your medical skills. So there's enough in the operating room, not enough weird stuff's going to happen in the operating room to keep you humble, hopefully. So again, just be humble. And if you're willing to listen to people and learn, you'll be fine as a senior resident.
Awesome. Well, Dr. Sridhar, I think me and Ankur can both say that you have definitely given us feedback. You've coached us through this process as medical students. And one thing I will say that has, I've told other people this too, is that you listening to us and listening to our ideas has given us confidence. I think it's given us confidence to do some of the initiatives that we've been part of, and also with some of our research endeavors. So we both really want to dedicate this episode to you, to thank you for being in our corner, and hopefully this will be for years to come, and we can continue to work with you and learn from you. So thank you for taking time to do this.
No, thank you guys. Thank you all the people who are in your class applying this year. I know it was a challenging year. I know you guys have do something unprecedented, doing virtual interviews as an ophthalmology applicant for the first time, ranking programs without ever seeing them, making friends who you've never met in real life. This is truly a generational shift that was forced upon us by the pandemic, and you guys have handled it admirably and really, really with flying colors. So I am super excited to do all as colleagues going forward in the future. And the one thing I would say is, if you have an interest in mentorship, pay it forward. Bilal, you're doing it this Ankur, you're doing it by joining this podcast, by paying it forward for medical students for years to come. And, you know, learn from your experiences, pay it forward. Whatever experiences you guys have at the end of the trail, I would suggest package it, you know, get your experiences together, write a document, put together an episode just about experiences, do something, because you guys have a completely unique perspective on this whole thing. We only know what we see in that one day when we meet you in interviews. You guys went program to program. Obviously, there's anonymous sources of info about each program, like the Google spreadsheet that's notorious and famous. But I really think you guys have an opportunity here to take a deep dive and really help the future generations. Because one of the big questions that's going to come from this year, and we don't have to answer this now if we're wrapping up, but are virtual interviews here to stay? Are the benefits of virtual interviews going to outweigh the risks? Let's say we get a vaccine, let's say the pandemic ends. If virtual interviews, if applicants come out and say, we preferred it for X, Y, or Z reasons, and programs come out and say, we preferred it for X, Y, and Z reasons, this may be the new normal. There's so many benefits potentially to this that you guys can discuss, like costs and travel and fatigue. Maybe outside of medical reasons like a pandemic, will this stay? And on the other hand, if you guys come out as a group and say, you know, we did this and we went through it and we persevered, but this was not what we would want for the future generations, that feedback should and will be heard. So really, really important for you guys. Hopefully everyone matches, they're really happy with their match. And then you guys come together as a group and say, you know, this is what we think about our experience this year. Again, kudos to you guys. I don't know if I would have been able to pull it off. So I congratulate all of you.
Thank you so much. And for anybody's out there, we are hoping to do a reflections episode at some point. Me, Ankur, and some other friends we've made along the way this year, and we will talk about what we kind of just went through. And for anybody who's out there, there's similar, even more greater content on Straight from the Cutter's Mouth, the Retina Podcast. Be sure to follow Dr. Sridhar on Twitter at Retina Podcast. You can check out the Facebook page as well at Retina Podcast, and it's retinapodcast.com for the website. Dr. Sridhar, Ankur, thank you both for joining me, and hope to see you in person both someday.
Thanks, guys.
Thank you, guys. Good luck with the rest of your interviews.
Thanks.